So do you remember back in December whenever we were talking about the TikTok plastic surgeon? Were you here then? You were here then.
So.
Yeah. So Dr. Roxy. So Dr. Roxy, for those who don't know, was a pretty famous plastic surgeon on TikTok. She had, I think, a little under 1 million followers.
Is she the one that did like the liposuction and people are awake?
No, that's a different one.
Oh.
I know it gets mixed up with all these surgeons out there. No, so this is a girl who was kind of TikTok famous. She makes funny videos. Well, she's about to learn her fate because she got her license suspended, and so she had to go in front of the medical board for her state, and that happened this month. So, as I said, for those who don't know, she was famous on TikTok. She made a bunch of videos. I think, Travis, I think I've got one video here. Can you roll it of her? It's like her.
Oh, yeah, I remember this.
Yeah, it's like her dancing, and I mean that's kind of the TikTok thing to like do these like silly little videos, and so that's her on TikTok. But the reason that she got in trouble was because she was live streaming her surgeries, which when I first heard that I was like, oh, live streaming surgery. I mean that's not crazy. I mean Dr. Miami got famous doing that, but where she got in trouble was that she got too involved with the live stream and wasn't allegedly paying enough attention to the surgery.
Yeah.
And so she had 2 patients that she was doing liposuction on in a live stream that had perforated bowels. And so for those who don't know, liposuction uses a hollow metal rod to suck out fat, and it's kind of aggressive. And if you're not paying attention or just something bad happens, you can actually get too deep with that and you can injure your internal organs. And so I have a video of her actually doing some liposuction. Travis, can you roll that next video? So when I saw that video, I was just really kind of mortified because she's doing liposuction on someone's neck.
She wasn't even looking at it.
Yeah, she wasn't even looking at it. I mean,
she was like, "Hi, how are you?"
She's sitting there talking about how dangerous it can be, if you poke something in the neck while she's aggressively, and that's pretty aggressive liposuction. I try not to be that aggressive with it. Like I try to do more controlled, because I mean it is potentially dangerous. And so anyway, so she had 2 patients that had perforated intestines, which I mean that is a risk of liposuction, but realistically, a plastic surgeon
that shouldn't happen.
Shouldn't happen really in their career. I mean, it could happen. It could happen to a great plastic surgeon. But it really shouldn't unless there was just some extenuating circumstances. But to have 2 of those happen and, have a video like that where she's like, not looking at the camera, obviously people found that to be a problem. And so the medical board suspended her license. And there was a 3rd patient too that had some serious injury but didn't really specifically say what it was. And the other thing that really kind of was alarming was when I was doing the research on this, apparently according to some of the people that had the complications, when they called her office, their office told them, don't go to the ER. Like, you're fine, which is always a bad idea. If you're out there and you have surgery and you feel like you have a problem, you need to call your doctor. And if you're really concerned, you should go to the ER. And that's what I tell our patients. And fortunately, we don't have a lot of patients going to the ER, but every once in a while, something will happen. A patient's like, look, I'm really concerned. I'm like, okay, well, I'm happy to meet you. But if you are really concerned, just go to the ER. I can meet you there. We can sort this out. It should be a little bit of a warning if a doctor,
Yeah, because that's like, oh, you're going to get me in trouble. Or like,
I mean,
ruin
who
my
knows
name.
what they were thinking? I don't know. I mean, it's possible. So anyway, the hearing with the medical board just wrapped up. And there wasn't really any good footage from it. It was just them kind of talking. And so she's trying to get her license back. And so they won't make the decision for a few more weeks. But I don't know. I mean, what do you think? I'm kind of doubtful if she'll get her license back. I mean, it looks bad. Maybe there's more to it that I don't know, but the optics of it look pretty bad.
Yeah.
You got 3 patients who were seriously injured. She'd been previously warned by the medical board not to do this anymore because they were worried she was going to potentially hurt somebody, and then it
just
happened.
Seems like she's just like so irresponsible and like blinded like by fame or something.
Yeah, and of course, she was saying that, oh, I'm doing all this for education, which I don't know. I mean, their response was, okay, you do 1 surgery for education to show somebody. You don't do 50 of the same surgery on live stream, or you could record it and then, there's ways to do it in a safe manner.
Yeah.
And
I wonder if she really saw an influx in patients.
Oh,
from it,
absolutely. Yeah,
really.
she did. Yeah, she became kind of TikTok famous, and so she was getting a lot of business, supposedly.
Yeah.
And I don't know. I don't know what's going to happen. I kind of think that she's probably not going to get her license back, but who knows? I mean, there may be more to it. I also worry too about malpractice because this is so publicized and all this information's come out. I mean, I can't imagine there's not some lawsuits involved in this. I don't know that for fact.
Sure.
And so it's like, well, is she going to be able to get malpractice? I mean, who knows?
I mean, who knows if she got those people to say that they were even allowed to like let her film.
I think that she was doing that for sure.
Well,
she would make mention that, oh, we always get consent.
Okay, good.
But it's interesting, the whole concept of live streaming, surgeries. I mean, I've thought about it in the past. I was like, well, I do stuff on social media. People want to see surgery. I mean, I've thought about it, but I just never really pulled the trigger on it because of all the various reasons I think it might be a bad idea. I mean, I think there is maybe some benefit to it, both from an educational standpoint and also like from a personal standpoint. I mean, she's a point in fact that you do something like this and it can build, your notoriety, which can build your business.
Yeah.
But I mean, there are downsides, and ultimately, I think
there's a right way to do it. I think she just did it the wrong way.
Yeah, I mean, Dr. Miami, who I don't necessarily love, I mean, kind of did it the right way. I don't think he had any issues when he was live streaming his surgeries that I know of. So yeah, you're right. There is a right way to do it, and I'm pretty sure that that's not the right way to do it.
Yeah, it was almost like she was like trying to show off.
Could be.
That's what I felt like.
And I mean, complications do occur. I mean, I can tell you, there's a saying in surgery that says, if you're not having some complications, you're not operating enough. Mm-hmm. And that is true. I mean, no matter what you do, there's always some risk involved. But the complications should be minor, little stuff. I mean, we do tons of tummy tucks. We see people that get like little healing spots, no big deal. We get them. But I mean, something like perforated intestine, I mean, that's a major complication. That's like potentially life-altering complications.
For sure.
Or potentially lethal too. You can actually die from that. So anyway, I will have to have an update next month when we hear the fate of Dr. Roxy and see what happens with her. I mean, it's sad. I mean, I hate to see anyone have problems, but
yeah, lesson learned though.
Yeah, lesson learned. It's a warning for other doctors and patients. So.